Dr. Naga is a unique blend of doctor, soldier, teacher, medical administrator, business leader, mentor, and social worker. After leaving the Air Force in 2013, he has served as a medical director and facility director in corporate hospitals, and currently he is the facility director of Fortis International Hospital, Rajajinagar, Bangalore. Besides that, he is also running an NGO by name of Vinosha Foundation. And thank you so much, Dr. Naga, for joining us and helping our students. The whole aim is for each of you to understand when you look at health science as a career in totality, there are a lot of scope beyond just thinking of medical, as a career line. And that's where we thought that why not to bring in a professional who can help you understand the scope about it. So over to you, Dr. Naga. Thank you so much, for joining us today.
Thank you, madam, for the kind introduction and the opportunity. I would always love to interact with the students and mentor them, because I always felt that I did not get the mentorship when it was needed for me when I was in this time, okay, between 10th, 11th, 12th. So we selected a career. Haphazardly, we selected based on something. It was not a well-informed decisions. So first of all, I would like to see all of them on the video. I wanted to see all of them in the video. Otherwise, then it gives me a personal, to see. Can all of you, Kangana, Darshini, Preeti, Param, Shaktivel, Pallavi, and all others, Priya, all others, can you come on camera?
Yes, sir.
Please do come on camera.
Everyone, if you can switch on your camera for some time, accordingly we can decide. You can change later, but do that.
Just
Yeah.
a minute, sir.
Sydney,
Sorry, sir, I didn't have a facility
That's
of
okay.
camera.
That's okay.
Sorry.
no problem. So are you all comfortable with English? Whoever can join, have the camera, can please come on camera.
Yeah, there are candidates who have joined in.
Yeah, Insha. Yeah. So, are you able to see? Look, are you able to see me? Hello. Yeah.
Yes.
Okay.
Yes, sir.
Yes, sir.
Yeah. So, which language you are comfortable? Are you comfortable with English? Is my English fine with you?
Yes, sir. English is absolutely fine,
Yes, sir.
sir.
Okay, good. So, now today, this time which you are living now, today's time, is a very exciting time. You know why? In our days, when we were doing our 12th standard, either you go for into arts subjects or you go into science subject. And in that also, only 2-3 things people will know. When you go into science subject, you can become a doctor, engineer, or an agricultural professional. Or when you go to arts, you can become a commerce graduate, you can give an arts graduate. Only these 5-6 career options were available. Then after your arts, you can go on to become an advocate, you can take up law and then become an advocate. So very minimal careers were there. Today's time, you will be surprised that there are more than 10, around, I read somewhere, around 9,000 to 10,000 career opportunities is there. Like for example, I'll tell you, suppose you are interested in cine field, okay, we'll think that, how many small world, this thing, you can become an actor, you can become a director, you can become a cameraman, you can become a lyricist, you can become a writer, you can become a makeup man. So plenty of opportunities are there. But unfortunately, what happens is we don't know, or we only think that, oh, actor means a hero or a director. That is only the job available. Similarly, in medical field, if you see, we all know that, medical profession means doctor. But yes, it's a fantastic thing. Once, if I'm not telling that you should not aim for the sky or anything like that. But what I wanted to tell you is, I have seen many people who wanted to become a doctor. They were not able to score adequate marks in the exams, but they did not give up. They joined a nursing profession. They joined a paramedic. They wanted to be associated with the medical profession. Need not be as a doctor. Doctor is one profession. See, those days are gone when people consider doctors as gods. Now, when the doctor presents the bill, the hospital presents the bill, they think doctors as the devil. So it has become like that. So apart from medicine, being a doctor, there are multiple professions are there. So shall we see what are the things available nowadays? Should we talk about it?
Yes, sir.
Yes, sir.
Okay. Yeah. See, first of all, the general advice I'll tell you. So whatever you do, okay, do it with your heart. Don't just take up a study for the heck of studying. Now you are maybe you are in 11th standard or 12th standard. Okay. Now you wanted to, you're studying. Okay. Maybe to satisfy your parents, or somebody pushed you into it, or you just studying. That doesn't work out here in any profession for that matter. Like for example, I put a coconut seed. Okay, I put a coconut seed or a mango seed into the soil. Okay. Now the mango seed, what it becomes? Will it become a coconut tree? When I put a mango seed, will it become a mango? It will want to become a mango tree, or it will become a coconut tree?
Mango tree.
Mango tree, right? You are clear about it, right? Now that means, what is the meaning of it? It means it puts its heart and soul to become the mango tree. It doesn't think of becoming something else or doing something else. Now you are studying and you are in the crucial part of your studies. So this 1 year, I have seen I have many examples. My friends, one of the guy came from a rural area. His father was not there, but he was wanted to do establish. He had two, three brothers were there. Brothers and sisters were there. Mother was working as a daily laborer. He wanted to become a doctor, and he wanted to do well in his life. So he worked hard. How he dedicated? When he reads, no, he used to see. I'll tell you an interesting tip for studies. Okay, so what are the 4 hours of studying? Do you know the 4 hours of studying, Priya? Param Shakti, anybody can tell? What are the 4 hours of
No, sir.
studying? 4 hours.
No, I think they don't know. They would love to know about it.
Okay, 4 hours of studying. Note down if you want. Read,
Yes, sir.
revise, recollect, recall, write. Read, revise, recall, write. Suppose if you do these 4 things, like for example, when you read something today, you listen. So when you listen to the class, what happens is, we have, how many of you seen Gajini movie? Have you seen that Gajini movie? Gajini movie, he has, what is the problem the
No,
hero
sir.
has? He has short-term memory loss, isn't it? So we have 2 types of memory. We have a short-term memory and long-term memory. Now, when you are listening to me, whatever you listen to me, it is in your short-term memory. Now, within an hour or 2 hours, if you don't recall, or if you don't revise that, it will just disappear. So anything you read or anything you learn, you should learn to put it in your long-term memory. How do you do that? What you should do for that? Suppose you listen to a class, you're going to the school, you're listening to the class. After the class, if you can just sit for 5 minutes and or during the interval period, just close your eyes and recall what all your teacher told you. Okay, if you recall, develop this habit. You know, practice is the price you pay for perfection. Practice is the price you pay for perfection. Now, if you practice this every day in your interval period, 5 minutes, you can even talk to your friends and tell me what this teacher told. You will be remembering 4-5 points. The other person will be remembering 4 points. If you all speak about that points for 5 minutes, this will go into your long-term memory. Once this go into long-term memory, then when you pick up the book in the evening and all the notes which the teacher has given you, just to go through that. Just, you don't have to memorize anything. It will just, you will be able to recall it. That's why revise, read, revise, recall, and write. And night, if you you just write what the teacher has done. Important points. You don't have to write the whole history. You just write one points what the teacher has told. Okay, once you do this, exam will be like a cakewalk for you. It will be just a cakewalk. Nothing difficult at all. you would have heard the story of Swami Vivekananda. When Swami Vivekananda was given a book, he used to just see like this, close it, and you ask him, he will be able to talk about it. Why? Because the power of concentration. It's not a magic actually. It's a power of concentration. So when your teacher is teaching, if you listen to, now I am telling you these things, if you listen to it carefully and practice this, your life will never be the same again. You will go to whatever you want to achieve, you can achieve. So how this can happen? Only if you recall what I said and understand and write and then recall and revise. Put it in your long-term memory. From short-term memory, put it into your long-term memory. That means you will not forget in your lifetime at all. Do you know what is, if I ask you the table, 7 4s are, what is 7 4s are?
28.
Tell me, you should tell me immediately. 7 4s are?
28, sir.
9 9s are?
81, sir.
Did you think or it came to you spontaneously?
It
Spontaneously.
was like
How
muscle
it
memory,
came to
sir.
you? Because over a period of time, you have put that in your long-term memory, isn't it? Now, when you were
Yes, sir.
young, small, no, you would have said, when I ask you 4 7s are, you'll say 1 4s are 4, 2 4s are 8, 3 4s are 12, 4 4s are 16, 4 5s are 20, 4 6 are 24, 4 7s are 28. But now when I ask you 4 7s are, you are telling 28. How? All these things have gone into your long-term memory. So the secret of studying is putting everything into your long-term memory. But what we do, unfortunately, like suppose your mother was angry with you and scolded you 1 month back. Now you put that into long-term memory and you will recall, hey, my mother scolded me. Your teacher has scolded you or your friend has hit you. Those things are nothing. But what do? You put that in your long-term memory and keep on recalling it. And when you recall a negative experience, what will happen? You will feel sad, you will feel hurt, you will feel bad. But we are very fond of doing that. Instead, you put a good thing. Suppose you studied well. You put it in your long-term memory and recall. Wow, feel happy. Wow, that day it was fantastic. So learn to be positive always. Learn to be positive. That is very important. Okay. Now, one important thing I'll tell you how to put things in long-term memory, and there is something known as a technique known as creative visualization. All of you watch sports. Do you know Tendulkar? Who is Tendulkar? Darshini, do you know who is Tendulkar?
Yes, sir.
Insha, you know Tendulkar? Okay. You know great sportsmen, like there is a guy known as Usain Bolt. So these sportsmen and all, what they do, before going to bed, when they are lying down in the bed, they visualize the next day. Suppose next day there is an important exam or tournament this day, they will visualize. They will see that they are doing fantastically in that match. Tendulkar used to imagine that the fast bowlers are bowling him at a very great speed, but he is able to tackle that and he is scoring good runs. He'll keep on visualizing that. So next day when he goes there and do it, so what happens when he visualizes what happens? So we have two minds. I have to tell you this. A conscious mind, isn't it? The thinking mind. Now we are all conscious. Everybody is conscious or sleeping? I don't know, because all of you are
Conscious, sir.
all of you have switched off your videos. I don't know whether you're sleeping or dancing or doing something else. I believe you're all listening to me. Yes or no?
Yes, sir. It's
Yes,
sure.
sir.
Yeah.
sir.
Yeah. Louder. I heard only 2 yes. Others are all sleeping.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay. I believe that you guys are all listening to me. Okay. So what happens is, this is the conscious mind. There is one more mind we have. This mind is known as subconscious mind. Have you heard of that?
Yes, sir.
Okay. See, what is the difference between a conscious mind and subconscious mind? Suppose if I have to tell you in relation to the elephant power. The conscious mind, if you take it as one elephant power, The subconscious mind has 100 elephant powers. Okay, that means it can achieve greater heights. So everybody of us, each one of us have conscious mind and subconscious mind we have. But subconscious mind is not now. Now is the subconscious mind at this moment? Is it active? No. When can you connect to your subconscious mind? When you are lying down in your bed just before going to sleep, or when you are just going to wake up in the morning. That is the time your connection with the conscious mind and subconscious minds are connected. That means with one elephant power, you want to connect with that 100 elephant power, you can connect at that time. But nowadays, what we are doing, we are having this guy, isn't it? This guy we are having. We just keep seeing some reels. Then we sleep off. And we get the dream of reels. And I mean, you guys are all good guys. No? You don't have this problem, right? You don't watch mobiles when you're going to sleep, fall asleep. Are you?
No, sir.
So tell me, how many of you keep the mobiles away half an hour before you sleep? Or 5 minutes before you sleep?
45 to 50, sir.
Huh? Okay, I presume that, you are supposed to keep your mobiles away minimum half an hour to 45 minutes before you sleep. It should not be near you. When you are lying down, you have to close your eyes and recall what has happened in the whole day. What did the teacher do? Good things. Don't think that fellow scolded, this fellow did something. I don't know. Good things you recall. Learn this habit. This is a practice. What did I tell you? Practice is the price you pay for perfection, isn't it? So now you want to perfect your life. No, you want to build up your career. You want to become a doctor, or you want to take up a profession which you love. So what you should do, you should now recall what has happened. Studies, whatever you have studied, you recall, revise. That is the revision. That takes only 5 minutes to 10 minutes. And then you visualize that you are writing the exam, your 12th standard exam. It's a fantastic, you know all the answers, and you are able to write the exam so nicely and clearly. Every day from today onwards, you visualize this. When I say visualize, it is not about repeating the words. You think you are the hero or heroine in your movie. That means you are walking to the exam. The question paper is given to you. You are writing the exam. You finish the first exam. The next exam comes, you are writing. The third exam, fourth exam, fifth, all the exams you have written. You have written fantastically well. Now your results are announced. You go and you see in the, wow, your name has come. You have passed the exam. You have passed with 90% and above marks. Wow. And then you got the seat, college seat, whatever you wanted, the seat has come to you. If you can visualize this daily basis, what happens? Visualize means you have to put yourself in that position without any doubt. If you can visualize this technique, very, very powerful technique. If you can do this daily, I told you, your conscious mind, what would have happened? Your conscious mind would have connected to your subconscious mind. That is, one elephant would have connected to 100 elephants. And that 100 elephants will make it happen. It would make it happen the way you want it to happen.
Yes,
So
sir.
this is the fundamental of career, your career. What now? Your career. Now, let us now talk about something about paramedical professions. What are there? What are the courses available? So many things are there. See, I told you around 10,000 types of courses are there in general. So in medical profession also, yes. First, let us see how to become a doctor. What you do, how to become a doctor. Now, if you have studied your 12th standard subject, 11th and 12th standard subject very well, the way I told you, 4 hours. Read, revise, recall, write. If you have done this, that subject, whenever the question is asked to you, it will come it will just come spontaneously. The way you said 7 4s are 28, it will come. The subject will flow out of you. Once that flow out of you, if you tell the correct answer, will you get a good mark or will you get a bad mark? Will you get full mark or will you
Good
get
mark.
a half mark? Huh?
Yeah, full marks.
You'll get
1
full
marks.
marks, right?
Full marks.
Now suppose
sir.
you, whatever questions, 10 questions are asked. Now you have followed this 4R technique and you have practiced visualization, creative visualization. You have connected with your subconscious mind. Will you get good marks or you'll get bad marks?
Good marks.
Good
Good
marks.
marks.
Good marks or excellent marks?
Excellent marks.
Will you get
Excellent.
excellent marks, isn't it? Why you're not sure about it? I'm not hearing anything from Kana, Mohammadi, Param Shaktivel, Radhika. Nobody's telling. Will you get good marks or excellent marks?
We'll get
Excellent marks,
Excellent.
sir.
You'll get excellent marks, right? So now you want to aim for excellent mark or you want to just pass?
excellent marks for sure.
Excellent
Is it
marks.
difficult? Is it difficult to do this? What I told you?
No, sir. It is easy.
No,
Is
it's
it
not
difficult?
It is
No.
not difficult.
No, na. So who is your? So you are your best friend or worst enemy?
Both.
You have to be. You have to be. You want to be your best friend or your worst enemy?
Best friend.
Best
Best
friend,
friend.
right?
Best friend.
So if you want, if you yourself want to be your best friend, you have to do this whatever I told you. Now,
Yes, sir.
now look around you. Now, if you want to become a doctor, or if you want to become, it is okay. If you get good marks, automatically you become a doctor. Good. I mean, you'll be eligible for that seat. Okay. Apart from the doctor, you can become a nurse. Nurses are more than a doctor. In a healthcare facility, all the doctors, you ask any doctor private, go and meet the doctor. They will say that because of the nurses, our profession is running. Because doctor will see a patient and the care will be provided by the nurse. The doctors consider nurse more than a god. Even the patients also, they will know if you're admitted in the hospital, you will know that the nurses are like goddess. So being now any profession for that matter, how many of you know? I'll tell you once. This one, you please remember this. Okay. Very important thing. A man should do. See, if your fate makes you a street sweeper, that means your fate somehow you become a street sweeper. Okay, sweep the streets like Michelangelo painted pictures. Do you know Michelangelo? Michelangelo was a very world famous artist.
A famous artist.
If your fate makes you a street sweeper, sweep the street like Michelangelo painted pictures. Sweep the streets like Beethoven composed music. If in music world, Beethoven is the best.
Is the best.
So sweep the streets is just sweeping the street, but sweep the streets like Beethoven composed music. Sweep the streets like Shakespeare wrote poetry. Remember this. A man or a woman should do this work so well that the living, the dead, and the unborn can do it no better. That means if your fate has made you to be a street sweeper, don't worry. But do it with all passion and compassion. You will be a big winner. You will be a successful person. It doesn't matter. It's not only that you have to become a collector or a doctor to become successful. You can be a nurse and be the best nurse in the world. Best nurse. Today's times, every profession is appreciated, respected. Yes, all of you wear a watch. Do you wear a? Have you seen? Do you wear an automatic watch, or you have seen a watch, right?
Yes, sir.
Watch in the front, there will be only two limbs will be there, isn't it? Small slim and long limb, isn't it?
Yes, sir.
Shows the time.
Yes, sir.
Yes, sir.
But if you open the watch and see in the back side, that you will see so many wheels in that.
Yes,
Isn't
sir.
it? So what is the meaning of that? Every wheel is one profession. Let us say one wheel is a doctor, one wheel is a nurse, one wheel is a physiotherapist, one is a paramedic, a lab technician, a hospital or a healthcare to run. All these wheels are required, isn't it? Time to show the time. Suppose in the backside of the one wheel is not functioning, will the watch will run?
No,
No.
sir.
No, it
No,
won't.
it will not run. So remember this. So first of all, you should be very clear. No profession is inferior to or no profession is superior. First of all, now you want to select a medicine as a career. You want to become a doctor as as career. Then you have to make sure that you are getting a good marks and getting qualifying marks. Okay. Now apart from that, you can also, if your marks are a little bit less, you can get into nursing. Nursing is, there is one diploma in nursing. Then you can read BSc nursing, then MSc nursing. And nursing may you can be a emergency nurse, you can be a critical care nurse, ICU nurse, you can be a ward nurse or a OT nurse. Again, I told you nothing. No, it's it's all specialized work. Like OT, operation theater. OT means operation theater. Operation theater work is little bit specialized. Suppose you are interested in that, you can take up that. It is all based on your interest. What you should do is, whenever you find time, say you have some time, just go through YouTube videos about what is it, what a typical doctor does, what a nurse does. There are so many videos nowadays. You can go through educational video which will tell you about each profession.
Okay, sir.
Then you choose, okay, I think my nature, I can fit like this. Then you go all out into that. Then you can take, when you say you can be an ECG technician, ECG technician is the one who takes ECG. ECG is the electrocardiogram to know the function of the heart. Then there is an ultrasound technician. These are all paramedical courses. Ultrasound technician is a guy who will take, put a probe in the stomach or in the heart and see how the organ is functioning inside. Is there any problems? Then they will give the report to the doctor. The doctor will see the things, then accordingly they will treat. A lab technician, what they will do, they will draw blood and they will give the blood. They will do the testing and give the report. Then when there's an OT technician, will help the doctor, surgeon, or the anesthetist in giving anesthesia to the patient and for helping in surgery. Then there will be a cardiothoracic technician will be there. He will be assisting a doctor who is doing a heart surgery. So paramedic and the nurse, if you see, the team leader is a doctor. Around him, and see, recently India won the World Cup. Did you see that?
Yes, sir.
Yes, sir.
Rohit
Yes,
Sharma,
sir.
did only Rohit Sharma may go and play, or there were 11 players?
There
There
were
was a
11
team.
players.
And then there were support staff. There was Rahul Dravid as a coach. Everybody joined together, no?
Yes, sir.
Yes, sir.
Yes, sir.
Only Rohit Sharma went and played, if only one person, would India got the World Cup?
No, sir.
No,
No.
sir.
No,
sir.
So medical field may everything is teamwork. So
Yes,
doctor is the Rohit Sharma captain. Then vice captain is a nurse, paramedics, then helpers. There is a big paraphernalia, big teamwork. So you can fit into any team, any of that. You can fit into any of the team member. Suppose so far I told you. First of all, I told you can study well. That is nothing. It's a mind block. You think that everybody has 100 elephants in them. Now it is up to you whether you wake up the 100 elephants now or you don't wake up. If you understand that you can do, do you remember APJ Abdul Kalam, our ex-president?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
So there was a guy, driver with him, with our past people's president. There was a driver in his place. So this driver he used to take APJ, our president, people's president, wherever he used to go. One day, APJ noticed him. Yeah, what did you study? Sir, I just was around 7th fail, sir. I got this job. Okay. He asked him, yeah, now you drop me in the office. I'm going to my office. You sitting, what you are doing? Nothing, sir. I will just sleep, or I will chit chat, or I will, smoke a BD, something like that. He told. You fellow, You are going to pass your time. If you are with me, you have to, be at least you have to pass 10th standard. I'll get you the books. When you have a lot of free time, right? After dropping me, you're sitting near the jeep and doing nothing. So you study. So APJ used to take interest in him and ask him, motivate him to study. So this guy slowly started studying. Dhire dhire he started studying. And he cleared his 10th standard exam. Then he cleared his 12th standard exam. He didn't stop with that. Now he suddenly got interest. Then he cleared his 12th standard. Then he joined with the APJ's help. He joined in the what do you call that, online classes. That time online class was not there. And what do you call that, postal classes, postal graduation. So he joined distance education. It's known as distance education. He did his graduation. Then he did his post graduation. Then he went on to do his PhD. And finally, now he is a professor in a college. What APJ did? He did nothing. He just stimulated him, guided him something. That guy identified his 100 elephants and he did this creative visualization. He took
Yes,
the
sir.
help he was getting from the environment and he went up in his life. If he can do, can't you guys do here? Dekho,
We can also do,
Madam,
sir.
Sheetal Madam and other people, they are helping you out to, realize your potential.
Yes,
They'll be
sir.
very happy. Your parents will be happy. You will be happy if you can identify and connect with your 100 elephants. If you read, if you recall, if you revise, if you write, and if you can visualize,
Yes, sir.
you can take any career for that matter. Doesn't matter you have to take become a doctor. You can become a dental surgeon. You can become a surgeon. You can become an anesthetist. So many professions are there. Similarly, paramedical courses, hundreds of courses are there. Graduates, if you want to do a diploma is 1 to 2 years course. Okay, you can do become a radiology technician. That is, you can take X-rays. You can do physiotherapy. You can do a physiotherapy technician if you do a diploma. So these are all reasonably earning. You can earn minimum, per month 20-25,000. You can have salary. You can have a decent living. And one more thing is, if you learn to live life properly, balancedly, then it will be very nice actually. You can learn a diploma. You can do a diploma in operation theater technology. You have heard about dialysis, where when patients have a kidney
Yes,
failure,
sir.
they will have to undergo
Yes, sir.
dialysis, isn't it? So the dialysis technician is one course. These are 1 to 2 years course. Then you can also go on to do a undergraduate course, 3 to 4 years course, bachelor in physiotherapy. You can do bachelor in medical technology, medical lab technology. You can do in radiography. You can do in anesthesia technology. You can become a technician for helping the eye specialist, eye doctor ko help karne ke liye. You can become an optometry. Then if you like that subjects, you can go on to do post graduation in the same subject. You can become from bachelor of physiotherapy. You can also do masters in physiotherapy. Like when you did a lab technology, you can do masters. You can do masters in X-ray technology. So in everything, there are so many opportunities is there, and you can earn a decent living. So your idea should be that you got an opportunity to become now you are in 12th standard or 11th standard. This time is not going to come back. You are anything you want to do. If the exam ke baad, whatever you score in that mark, that becomes your mark for your life, 12th standard mark. So from this moment onwards, you should not, first of all, you should not worry. You should not get tensed. No need for any tension. You should be intense, but not tensed. Did you understand?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yeah. So you should not be tensed. You should be intense. Intense means like, in a football match, you will see the football guys, are they tensed? No. The football guys are intense. They are running, kicking, they're running.
Yes, sir.
Oh, whole thing, 45 minutes, they'll keep on running. Intensely, they'll be playing. So like that, you will play intensely without any
Yes, sir.
tension. Okay, you have to compete with, who is your competitor? Nobody else. Your competitor is yourself. I
My
always
role
compete.
for yesterday.
Yeah, if I compete with others, I will look at them and feel jealous, or I will feel inferior, or I will feel angry. But if I take myself as a competition, what I will do, I will be better than what I was yesterday, day before yesterday. Tomorrow I'll be better than what I am today. So, my dear friends, don't look at others and feel bad or feel inferior or feel upset or tension. नहीं, कुछ नहीं.
Yes,
भैया
sir.
आप कल कैसे yesterday, how were you? Are you better today? That
Yes,
should
sir.
be your aim. Okay, and you have to, if you are all friends, you have to share your with you knowledge with each other. Suppose if I teach you, or if you suppose you studied some formula today, your friend is there, you have studied, say, a square plus b square is equal to ab square, or I don't know if that's correct. A square plus b square plus 2ab is equal to ab whole square, a plus b whole square. Huh?
Yeah, that's correct.
Yes, sir.
I
Yes,
forgot
sir.
it. Long time it was. Okay. A plus b whole square is equal to a square plus b square plus 2ab. Okay, if this is the formula. Okay. Now, if I tell to you, if I have studied it, you have not studied. Now, if I don't tell you, what happens? If I had not put things in it will be in my short-term memory, and from my short-term memory, I will forget at the time of exam, I will forget. But if I come and tell you, yeah, did you know what I read today? A plus b whole square is equal to a square plus b square is equal to 2ab. I tell you. I tell to Param Shakti, I tell to Mohammadi, I tell to Insha, I tell to Kanna, every time, one time. So
Yes,
they
sir.
will be listening or not listening, I don't bother. But what is happening for me is, I am putting that formula from my short-term memory to long-term memory. I keep on putting 5 times, I put no. The exam comes, I don't have to memorize it. I will know by heart. 7 4s are 28. A plus b whole square is equal to a square plus b square is equal to 2ab plus 2ab. I'll just know like this.
Yes,
And if
sir.
that question comes in the exam, I will just clear. And if I write all the questions rightly, I'll get the maximum eligible marks. And if I get maximum eligible mark, now I can decide what I want to become. I want to become a doctor, or I want to become a paramedic, or I want to become a nurse, or I can choose it. I can be a chooser. I can choose the course. Otherwise, what happens? You just get the borderline marks. Now I become a beggar. I go beg to people. Yeah, please give me this seat. Please give me this seat. Please give me this seat. I am interested to study medicine, but I am not willing to work for it. I need that seat. Is it a good way? Or the way APJ Abdul Kalam's driver, who was even not studied, he was not even 8th standard, he goes on to become a professor of a college. It's a real story, okay?
Yes, sir.
You can Google it and find. So this is what you have to aim, man. Today's
Yes,
time
sir.
you have been given such a wonderful opportunity. देखो शीतल मैडम ने इतना effort लेके उनका organization, everybody wanted you guys to become better in life. What are they going to get for that? Nothing. Just seeing you becoming a better person, they will be happy.
Yes, sir.
That's all. No. If you are your
Yes,
best
sir.
friend, if you are your best friend, you will do this, or if you will do something else.
We
Only
will do
people
this,
who are
sir.
their worst enemies will say, यार बाढ़ में गया मुझे क्या होता है? I am not bothered. I'll do whatever I want. But if I understand that I have an opportunity to connect with my 100 elephants, and I can achieve what I want to achieve, then nobody need to tell you, yeah, you become a doctor, you become an engineer, you become a paramedic, you become a nurse, you become a physiotherapist, you become a lab technician, you become you become anything. From head to toe, there are so many organs, isn't it? For every
Yes,
organ,
sir.
there is one specialist doctor, and there is one specialist paramedic, there is one specialist nurse. As simple as that. You have head, brain, you have heart, your lungs, you have stomach, intestines. Every organ in the body needs support,
Yes, sir.
isn't it? So the days are gone. Previously when we were studying medicine, this was only a general specialist, general
Yes,
doctor.
sir.
He will be able to see every type of ailment. Now it has become a specialized courses. Okay, so don't worry. Just to develop interest. Suppose you like and something comes naturally to you. Identify what is your interest. How you can do
Sir.
that? You have to attend to classes. You have to discuss with people. You have to, at the same time, whatever subject you are studying, study with full intensity without any tension.
Yes, sir.
Okay, so then things will happen.
Yes, sir.
Things will happen for your better. Nobody, I mean, you can just be an achiever. Yeah, tomorrow, like after you finish your 12th, you get your medical seat or a physiotherapy seat, whatever seat you get, and you do well in that. I told you, a man or a woman should do their work so well that the living, the dead, and the unborn can do it no better. Suppose you become a physiotherapist, you become the best physiotherapist. What is preventing you? You become a paramedic, aim to become the best paramedic in life. How will you do? You have to keep your passion and interest. You have to develop that compassion. Okay, so I'll stop at this time. You have any questions, you can ask me, I can tell you.
Any questions, anyone?
No questions, sir.
No
Others,
questions.
if you have.
No
No,
questions,
ma'am.
sir.
Yeah, I think Darshni. Darshni, go ahead and ask a question.
Am I audible?
I'm
Can
not
you be
able to hear
little
you.
louder? Can you be little louder?
Am I audible now?
Yes.
Audible, but very mildly audible.
Can you hear me now, sir?
No, ma. Little bit louder. I think you have to keep your mouth near the mic.
Can you hear me now?
Now we can hear you better.
It has been so wonderful till now. I have a few questions. I am a 12th grader studying in an integrated college and have chosen NEET as a competitive exam which I'm going to be attending. So what would be your advices you will give for students who are attempting NEET in 2025?
Yeah. You're attempting this year or next year?
2025. Next.
2025. You have one more year, right?
Yes.
Okay. So what is the things I told you? You have to start your creative visualization technique from today onwards. You have to start doing that. You have to put everything from your conscious mind to subconscious mind. You have to have a dream. People, up to APJ told, if you have a dream, the dream will not let you sleep. So that means you will be motivated, highly motivated enough to write the NEET, to do well in the NEET. And I told you, don't get tensed. No need to be tension. Tension is one thing. You will not, get into tension from today onwards. Each one of you have to promise yourself. Repeat after
Yes,
I tell
sir.
you. Repeat what I tell you. I promise.
I
I
promise
promise.
I will not.
I will
I
not.
will not.
I will not.
I will
I
not.
will not.
Note it down so that you can also read every time when you feel that. I promise that I will not allow anxiety, tension, or self-doubt creep into my mind. I will not allow
I will not
anxiety.
allow.
I will not allow anxiety,
I
tension,
will not allow
or
anxiety, tension.
self-doubt to get into my mind. I will always stay calm. I will always stay calm. I will always stay calm and put in my best efforts. I will always stay calm and put in my best efforts in whatever I am doing. I love my studies. I enjoy my studies. I understand what I am studying, and I'm able to recall and reproduce what I studied. It's a fantastic feeling. I'm so happy about it. I feel so happy. I feel so happy about it. I am getting good marks in my exams, competitive exams. Whatever exam I take up, I get very good marks and good results. I enjoy studying. So Darshini, if you write this, keep writing and then keep talking and visualize. Okay, this is the first thing. See what happens. No, what happens is we we don't do this actually. This is very simple, but we don't do this actually. But those of you who have been attending this session today, if you can put this in practice, I told you,
Yes, sir.
practice is the price you pay for perfection. Day one, day two, few days you will be able to, this will become your second nature. So it is like sharpening the knife. Once the
Yes,
knife
sir.
is sharpened, no, you can cut a banana, you can cut a bread, you can cut an orange, you can cut anything. You can cut a chicken. So sharpening the knife is important. That is like that. Which course you are going to do is doesn't matter. You can go into any course of your interest.
Yes, sir.
Okay. So do that, and I'm sure if you whatever I told you today, if you can put that in your long-term memory and practice it, putting into practice is important. See, I can tell you
Yes,
so
sir.
many things. I can tell you so many things. I can tell you so many things about everything. But I think if you understand, I have told you a very critical point for your growth, for your development. Today, whoever you listened, and I don't prepare my speeches. I don't prepare my talk. Okay, on the nature, I just think. So one
Yes, sir.
important thing is that once you do this, now should somebody tell you how to manage your time? I don't think so. You know to
No, sir.
manage your time. You will
Yes,
now
sir.
suppose if you revise, if you recall, you will keep on building on your subject knowledge. Teach somebody. But anything you do, be mindful of your time. Don't waste your time because this 1 year or 1 year will be the time will fly off. So revise properly, learn, stay calm. Mind is the most important thing. And then every day sit for 5 minutes. Just observe your breath. Sit erect. Keep your hands in the side. Just close your eyes. Just observe your breath at the root of the nose. Just inhale, exhale, inhale, exhale. 5 minutes do. Morning 5 minutes, evening 5 minutes. This will calm your mind. See, for example,
Yes,
I
sir.
tell you how this is related. Now, suppose you are anxious. What will happen? Have you noticed? Your breathing will increase. Isn't it? If your mind
Yes,
is
sir.
anxious, your breathing will increase.
Yes, sir.
So now what you are
Yes, sir.
doing now, when you're breathing slowly, inhale, exhale. The reverse thing will happen. Your mind will become calmer. Calm, it will become calm. And if you practice this every day, practice is the price.
For perfection.
Practice is the price you pay for perfection.
Yes, sir.
So these are simple techniques, simple things, but very, very effective. Okay.
Yes,
So
sir.
you guys have to do this. I will ask Chital madam, after 2 months, or 1 month, I will ask whether you guys are doing it or not. Today, if you are not put what I said in your long-term memory, you will feel good listening to me. You would have felt very and all. But if you are not put it in your long-term memory, it would have gone. Tomorrow, if you ask, oh, who is that fellow, Dr. Nagasubramaniam? Something I heard that Sheetal madam ne kuch class ke liye bulaya tha, hum log ka, we connected. And I also said yes, yes, and all. That's all you'll remember. So write it. It is your life.
Yes,
Your
sir.
life is in your hands. you can make or break it, isn't it?
Yes, sir.
So in a village,
Yes, sir.
I'll just finish that story. I'll just finish with that. In a village, there is a gathering. One sadhu comes, so everybody gathers. They want to take wisdom from him. They want to learn from him. So many people ask questions and all. So there is three notorious friends. So they want to corner him because they are thinking, why this old man, everybody is respecting him. Why they are this thing, they're falling at his feet. This fellow, I don't believe. This fellow is not good. So they want to put him down in front of everybody in the village. So these three naughty boys, what they do, they take a small bird and they keep it in their hands. They'll ask him, tell me, you are a foreteller, you will tell everything. Tell me what will happen to the bird in my hand. So the sadhu looks at them and smilingly says, so now what they do, suppose they say that if the sadhu would have told that the bird is going to leave, they will just crush it and kill it. Suppose sadhu answers that, they're asking, what will happen to the bird? Suppose sadhu says the bird will become free and fly, they'll just crush it and kill it. Okay. Suppose the sadhu says the bird will get killed, they'll just release it and fly, make it fly away. Why? Basically, they want to tell that what you are telling, you are not a big man, you are an ordinary man, you are just trying to fool people. So that guy had a wisdom, he was a man of wisdom. So now you look at them and smilingly says, see, what will happen to the bird? It may get killed or it may fly. It depends upon you.
Yes,
Isn't
sir.
it? So
Yes, sir.
whatever I told you, you want to make it happen in your life or you want to
It
forget?
depends on us.
It depends on you guys.
Yes, sir.
Okay. Any other question
Yes,
is
sir.
that? Or
No questions, sir. No questions, sir.
I'll ask you one question. Okay, Darshini, go ahead.
So I have a last one question. So
yeah, tell me, Darshini.
as biotechnology is booming field right now in India, what do you think about as a career option in the future?
Tell me, okay, you asked about biotechnology as a career option in India, right?
Yes.
Okay. Now, every technology or everything, it is good. Okay. So there'll be, like, for example, if I'll tell you, like, there are hospitals are coming up. Hospitals now are using machineries. Okay. What is this biotechnology technician means? Biotechnology course means that is, they go on to repair the ECG machine. They will repair there. There'll be ventilator will be there, which heart lung machines. If you go on to a hospital, you will see hospital will be filled with lot of machines. So the biotechnology, the biomedical engineer will do repair work on that. That is one field. Biotechnology per se, there are so many, there is nanotechnology is coming up, research technology.
Yes, sir.
See, sir, it doesn't, I told you, it doesn't matter what course. First of all, if you suppose you got interest in biotechnology, keep reading about it every day. Just little bit of information collect. Now, if you like it, pursue that.
Yes.
Otherwise, it does. What I want to tell you is, because today's times, what happens is, I will tell you cricket parlance. Cricket parlance you need to be an all-rounder. You need not have to be a specialist batsman or a specialist bowler. You have to be an all-rounder. Okay, you should develop your all-round skills. So tomorrow, if you are interested in biotechnology, pursue it. That session will be that biotechnology. You will be a good biotechnologist. So there is no, it is not wrong in being a biotechnologist. That's what I would say. In the sense,
Yes,
there
sir.
is a need for every branch of medicine. Every branch of medicine has a need, and it will be useful for you. So that don't worry.
Yes, sir.
Okay.
Yes, sir.
Yeah.
Thank you, sir.
Doctor, I'll have
Well,
one
ma'am.
question for you. Okay,
Yes,
go
ma'am.
ahead. Go, Priya. Go ahead.
Personally, I thank you so much, ma'am. I am the teacher from rural area from Sri Lakshmi Vidyashram. This is very helpful for me, ma'am. Thanks for allowing us to join.
Yeah, thank you, Priya. We're so glad to know about this.
Okay.